blood tests for anemia. What do I need to ask my doctor to test for? We don't even use hemoglobin as a reading for iron deficiency in Australia.
In the States, hemoglobin is like, everyone gets hemoglobin drawn pretty much all the time.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I'm naturopath Fiona Chin, and I'm joined today by the beautiful Jessiana Seville from the Kidney Nutritional Institute again.
Yes.
So why don't we start with what is anemia? What is iron deficiency? What does that look like, and how would someone know that they've got that?
Great question. So anemia is characterized by not having enough red blood cells, essentially, not being able to oxygenate your red blood cells. Hemoglobin is the part. Oh, and I'm sorry, I'm getting ahead into test values. But if you can't, to simplify, if you can't oxygenate your tissues, right? Our red blood cells carry oxygen to all our tissues, among other things. And if you don't have enough, or if you don't have the right components on these red blood cells to carry oxygen, then your tissues are starving for oxygen, and that really prohibits healing. It prohibits, function. It's just a very critical part of overall health. I mean, all of us know what it is to take, a deep breath, and how important air and oxygen and breath is to how we feel. And it's the same for all our organs. You have to have your blood to be able to carry it around.
So run me through the blood tests for anemia and what people are looking at on a panel, because I know we were talking about this earlier, but sometimes it gets missed because people are looking at the wrong thing. So if someone's like, well, I am tired and I've got, and I'm on a plant-based diet and I've got kidney disease, what do I need to ask my doctor to test for?
Great question. So I'm going to answer this in two ways, because I'm going to answer what's being looked at and also what's not being looked at, because anemia is very much dismissed. So in the States, hemoglobin is probably the number one thing that is looked at for anemia. Wow. What's really interesting and what we've seen happen is that hemoglobin levels sometimes are being interpreted by the physicians or nurse practitioner, whoever is kind of calling the shots. They're being interpreted by dialysis standards. So patients on dialysis, often they're taking the hormone Epogen, and if you're on Epogen, you are purposely kept mildly anemic, because the research showed that if you have normal hemoglobin levels, you're more likely to have a cardiac event. So you're purposely kept slightly anemic. It's a real tough target. But sometimes our CKD patients get clumped into that group of people, even though they're not on Epogen. And so they'll be aiming for like 10 to 11 on their hemoglobin levels, and we want to see 12 to 14. So hemoglobin is what is looked at first. If your hemoglobin is low, you're anemic, 100%. But you can be anemic and have a normal hemoglobin. And this is where it's really important to look a step deeper. So it's often dismissed. And again, I don't know what do they draw for you?
Well, yeah, if we do an iron study, so you'll get ferritin, total iron, and then transferritin, total iron binding capacity. In fact, I would say we don't even use hemoglobin as a reading for iron deficiency in Australia. That would just be a backup to say, oh yes, iron says you're anemic and you've got low hemoglobin as well. And we would look at macrocytic and microcytic cells and looking at cell size as well. But yeah, no, hemoglobin's not one we commonly use. It's just a backup. So that's so fascinating that you guys use
so it. across countries, different practice, which I think is super important. So in the States, hemoglobin is like, everyone gets hemoglobin drawn pretty much all the time. They don't always get a full iron study like you talked about. And so for our patients in the state, this is something we often will request. And if you feel like you're tired and it's been dismissed, oh, your hemoglobin is normal, you're fine, you can ask for an iron study. Can I just do a full anemia workup where you get what you said, a ferritin, a TIBC, a transferrin saturation, a TSAT. You want to get all of those labs because you want to look at them, because it'll help you identify if you're truly anemic, and are you iron deficient anemic, or are you are you B12 anemic? Like, what kind of anemia do you actually have? So that's why I just think you have to get the full set of labs on anemia to really dig into it. So in the States, if you're watching this from the States, If your fatigue and tiredness has just been dismissed and like, you're not anemic, hemoglobin's normal, you just have kidney disease, that's why you're tired. No, like, don't let that be the end of the story. Get a full iron panel so you can really make sure that you're not iron deficient, because that's so easy. It's so easy to fix. It really is so easy to fix. And then from there, what we like to look at is we do like to look at ferritin. We like to look at the TSAT. Those are a couple that we'll really hone in on to see, what are the trends? Are they really deficient or not?
Yeah, that's really interesting, because in Australia, a bit like the hemoglobin, we can get iron. So for instance, I got this really crazy virus when I'd come out of hospital from a broken hip, and my iron levels and hemoglobin were normal, but my ferritin was 2. So it was on, yeah. And in Australia, I don't know what your reference range is there. I know over 30 is normal. We like it over 50. I say anything less than 50 is anemia. And that's really, it's the ferritin level that we look at. So yeah, it was interesting. So my GP, at least who's very good, is like, well, you're on transfusion levels. And I said, yeah. And we just knew it was the virus had just chomped through and all the inflammation that you spoke about. So I found that interesting, but my iron was completely normal and my hemoglobin was normal. It's like the body almost had upregulated to carry more oxygen to try and heal. But if that had gotten missed long term, I would have crashed into a very low anemia, because my stores had completely gone into nothing. What else do we need to say about anemia and kidney disease? Is there anything else that I've missed or we haven't covered that you think people need to know?
I think probably as a recap is that it's easy to change, right? You just get the labs done. If you have chronic kidney disease, you haven't had a full iron panel in a while, at least like once a year, you should get that and keep tabs on, what's going on. I think that is a prudent thing to do, is to at least once a year, probably even if you don't have kidney disease, it's good to keep a tab on that. But even if you don't have kidney disease, once a year, get an iron panel or iron study, as you would call it, and then make sure you have all the labs. So you have a baseline, and you can also see if things start to trend down. Because like I said, it's so easy to fix with your food. That would be a couple of things that I would very heavily emphasize. The other thing that I would emphasize is that if you're moving towards a plant-based diet, which we love those, I think they're fantastic, but if you're moving towards a plant-based diet, then make sure that you're considerate and conscientious of adding in some of those mineral-rich, iron-rich foods into your diet, because it's super easy to get a hole and 3 to 6 months you're like, man, why do I feel so run down? But you can just put it in your diet. Sesame seeds, some of the nuts, the pepitas, the snow peas, all those things can really add those minerals into your diet without having a lot of meat.
I'm just grateful to have you as part of our resource team. So I think we feel very blessed, and people have been loving the videos, by the way. So we've got some really great comments. And if you want to know more about what we do, head to www.kidneycoach.com. You can find out about the Kidney Disease Solution Program there, and our supplements on Kygenesis. We've got a few there as well. Remember to hit subscribe. That way you'll get notified anytime we put up a new video. And thank you for being part of our community. We look forward to seeing you next time. And Jessiana, thanks again.
Yeah, thanks.